Hello, everyone. My name is Damien Ricard. I'm an intensivist. I work in a teaching hospital near Paris in Cologne, and I'm head of the ICU. It's a 12-bed ICU in this hospital. I'm interested in nasal high flow for at least 10 years. In this talk, I'll be addressing the issue of predicting the outcome of nasal high flow in acute respiratory failure and in the context of COVID-19 related acute respiratory failure. This is really a key issue because we know that the timing of intubation is crucial in these patients, and the whole problem is to strike the correct balance between not intubating the patients too early and not intubating them too late. And this is what I'll address in this talk.